Hello, good evening, and thank you for joining us on News 360. It is live from our news hub here at Adesawe Kanda in Accra. I am Aisha Yakubu.
My name is Alfred Okonse. Coming up tonight.
Ghana Health Service feverishly ready storage facilities for first consignment of COVID vaccines to arrive in April.
How prepared is the country in terms of capacity and storage of the vaccines? Wendy Laryea has been finding out.
To know more about the storage of vaccines at the national level, I'm currently here at the national storage points, and here a lot of vaccines are stored and distributed across the country. I've just entered a cold room, and vaccines here are stored at a positive temperature. At the national level, the cold rooms have 4 refrigerators for storing vaccines between +2 to +8 degrees Celsius and 1 freezer for storing vaccines up to -15 degrees Celsius.
We have 5 cold rooms within the store. This is our negative cold room. For special vaccines like polio and the rota, we store them in negative.
Currently, there's only 1 cold van for the transportation of vaccines.
We push the vaccines out to the regional cold room through the cold vans. Currently, we have 1. There's 1 on its way, another 1 on its way. But we need additional. So if we have any institution that is prepared to support, that institution will be welcomed and acknowledged. And ideally, we need 1 cold van for each region. Okay. We did have, but they are all broken down.
There are different kinds of vaccines and their storage requirements. As the country prepares for the intake of the COVID vaccines, the national manager of the expanded program on immunization of the Ghana Health Service, Dr. Kwame Amponsa Achiano, says some factors account for the intake of a specific vaccine.
Food and Drugs Authority are the ones who would look at the dossier and say these vaccines are safe and therefore we would register them. We have a National Immunization Technical Advisory Group that normally advises government, the Ministry of Health, on vaccines and technologies. They have met about 3 or 4 times. They've come up with some recommendations and are advising us what to do, what to go for and what not to go for. Okay. So in the scheme of affairs, you look at the whole, not just the effectiveness of the vaccine, but you look at safety plus whether your system can also handle it.
But do we have the storage facilities, and what kind of vaccines are we looking at importing?
We think that the AstraZeneca Oxford vaccine will be most suitable for now. Of course, we are also open to receive others, so long as we are able to upgrade our cold chain system. The one I mentioned, which is the AstraZeneca one, requires just the normal temperatures that we know we are used to, +2 to +8. The ones we use. I wouldn't say we have enough capacity, but normally when you are introducing a new vaccine, you build a capacity. And we think that within the confines of or within the limitations of that we find ourselves in, we can build that facility within the shortest possible time.
According to Dr. Kwame Amponsa Achiano, capacity will be built to augment the country's cold chain system.
For whilst we start with AstraZeneca or any other vaccine that will fit into our cold chain system, we will then be planning also to receive those vaccines that require ultra-negative storage. By the close of next week, we will know exactly what the gap is, especially at the peripheral, the very peripheral level. The next couple of months, we'll get the storage issues sorted out. Currently, as I speak, I think it's only 1 region that is outstanding in terms of cold chain equipment distribution. But with additional vaccines, we think that we will need some additional cold chain storage equipment. That's why we are doing the gap analysis.
He also touches on the need to purchase the necessary equipment for storage.
As for the funding, I am very much aware that World Bank has earmarked some money for it. I should think it should be about $4.5 million.
The national manager of the expanded program on immunization of the Ghana Health Service explains the procedure when a vaccine arrives in country.
So it gets to the airport and then we have to clear it. Traditionally, we need to clear it within 24 hours. Then it's carted to the National Cold Room. You have regional cold stores, except for the 6 new regions. So their parent regions will then, they will serve them. So we push out the vaccines to the regions, and then the districts will pick from the regional level.
Wendy Laryea, TV3 News.